Hi there and welcome to Body Beautiful. I'm Janelle Marie. This is the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, our good friend, Dr. Joseph Mealy. We're talking about different procedures today. We've got tummy tucks, we've got breast aug, we're going to talk about oh no, we're not. We got just a bunch of stuff to talk about. A lot of stuff. We're going to talk about a whole bunch of stuff. Before we get started, of course, any advice we give you today, we want you to consult your own physician. All right, let's jump right in. Dr. Mealy, first of all, it's so great to see you again.
Nice to be back.
We love you. Our viewers love you.
Yay.
And we just love what we talk. Yay.
Yay.
So
no, I have the best job. So
you do have the best job.
That's a good thing.
And you bring us just such great stuff. So we're going to talk about breast augmentation. Right off the bat, I want to talk about, is it still the #1 procedure, breast aug?
Still #1.
Yeah, everybody's still getting the breast augs, huh?
Liposuction catching up here and there, but
really?
Breast aug very consistent.
Very consistent with the breast augs. All right, so who's a good candidate for breast augmentation?
Well, there's a couple sort of groups of folks that come in. One is folks who just have small breasts, have always had small breasts, that want augmentation for size.
Okay.
The other larger group I have is folks who were pretty happy with their breasts before having children.
Yes.
And then afterwards they get bigger with pregnancy, they shrink, they involute, they droop, and either we just restore them with volume using breast augmentation, or sometimes we have to do a lift in that situation too.
Yeah, breast aug and breast lift, those are two different things. Can they be combined? Do you do them usually separately? Is it just based on the person and what's going on?
Exactly.
Okay. All of the above.
Yeah, all the above are true. The lifting, it depends on the type of lift. I like to combine them. Some doctors would rather separate their hazards and do the aug and the lift separately, but I think in most cases it can be combined very easily and well. They're complementary, so the lift will tighten the skin while the implant adds volume.
All right, let's go to the pictures. First picture we have got here, that is a beautiful set of pictures there. And okay,
so this is someone who's
here?
just kind of small to start with, never really had a lot of volume in the breasts, and what we're doing is restoring volume. So we're giving her some upper pole fullness.
Okay.
We can give her a little bit more cleavage by adding that volume. And in her case, a lift, not necessary. The advantage for someone like this is she'll likely not need a lift. Unless something radically changes with pregnancy or weight.
Gotcha.
Her breasts are small. They would tend not to sag over time without the implant. They tend not to sag with the implant.
And in the after picture, I mean, that is a beautiful, augmentation.
It's proportionate.
It is very proportionate and very natural looking, which I find, I mean, is just amazing with you. Very,
it's much
very
easier
natural.
to shop for.
Oh, yeah, it is. That's true.
A lot of times people are coming because their clothes don't fit well.
Yeah.
And if we go too large, they've got the same problem in a different direction.
Absolutely.
So they can't get the buttons to stay.
Yes.
So with an average, normal, proportionate size, it still looks good. And at the same time, you can fit in well in clothing, and that just makes it look even better.
Love that. Picture #2.
Sure. So there's someone with a little more sagging, so a little ptosis.
Okay.
The lower pole, a little bit more full in the upper pole, but still pretty empty. And it's what we call pseudotosis. So the nipple is low, and then the breast tissue itself is low, all below the fold. In these cases, if we just add an implant, it tends to look like we've done a lift. But we're not doing a lift.
So you didn't do a lift on this one?
We're just adding volume.
Oh, so
there are some times when the nipple is very low like that where we'll do a lift, usually a smaller lift. Like a periareolar lift or maybe a vertical lift is necessary. But there are times when the nipple is still above that fold and just adding the volume takes care of it.
That's wonderful.
Yeah.
Now, Tammy from Alamo writes in, and she's got a question. What is the recovery time with the augmentation? I can see also that there's no visible scars here. It's a beautiful job. What's the recovery time?
So the recovery for people, it varies a little bit. I would say, if you're trying to do it Friday, go back to work Monday, going to be hard. It's going to be sore still. I think the first couple of days, I've had patients we weren't friends for a couple of days, but by the end of the week, all's forgiven and things are looking good. So I think if you can take a week without having to do heavy lifting, that sort of stuff, it's sufficient.
Let's go to the next picture. And while I show that picture, what about, do you put them to sleep? What's the twilight like? Tell me about that.
So I do this under anesthesia, so people are completely asleep. The nice thing is the first question I get when they wake up is, when are we going to start?
Oh, really?
So the whole part in the middle you don't have to worry about. This patient also has a very small amount of breast tissue.
Yes,
and in some ways it's more challenging because the larger the proportion of the breast that's made of the implant, the more likely it is to look like an implant. This is not a shaped implant. It's a round implant. It's behind the muscle, which does tend to taper it better. And I think I don't have to worry about the shaped implant rotating. If we're using a smooth round implant, if it rotates, it looks exactly the same.
And let's go to the next picture while we talk about how do you, what kind of implants are out there and how do you choose behind the muscle or above the muscle? Because I always think, is that per person? And what types of implants?
Well, there's still the two main types, saline and silicone. Pretty much all the silicone implants are gummy bear. They're cohesive now. So if you were to cut them in half, they would stay as two halves.
Like
if
a gummy bear?
It doesn't migrate through the body, and that was the problem in the past. So for this patient, some people would say her breasts are big enough. But she's missing the upper pole fullness.
Oh, upper pole fullness?
So in the upper pole, it's really made up of just her muscle. And luckily for her, she has some muscle up there to add fullness.
Right.
With the implant, we can give her a little more projection, which is the size she was used to having before, and at the same time, increase that upper pole fullness.
And did you do a lift with this patient?
In this patient, no.
Okay.
No.
And our final picture, and this, Looks like, no, I don't think you did a lift on this either, did you?
No, these are just breast augments.
Oh, these are all just breast. Oh, okay, okay.
You know, in this case, she has pretty adequate breast volume, but she has a little bit of a tubular breast. It's a little pointy, a little puffy up underneath the nipple. Implants can help flatten that out. There are some times when I will use a periareolar lift, not so much to lift, but to really mold the shape so that the skin will stick or adhere better to the shape of the implant, so it's not puffy, not sticking out on top of it. We don't want to scoop on top of a scoop. We just want one smooth round breast.
That's very natural. And a
and
lot
again,
of women,
her upper pole is much better off.
Yes,
before
she has
had
that
this sort of
fullness on
flatness
top of it.
above, and that just fills
but
it out.
natural, not too high. You know, it gets
No, and if you want
too
to
high.
look bigger, you can still wear padding. You can still wear, you know, a push-up bra that gives you a
Chicken
lot of
cutlets
extra
is what the
form.
ladies call it.
There you go.
Real quick, a lot of women want to know if they can still breastfeed. Can they still
Yes,
breastfeed with
breastfeeding is still
implants?
recommended.
Yes?
You may make
Okay.
a little less volume, but the implant will not change the way the milk is made or the type of milk. Or it won't change the milk, don't taint it in any way.
Sounds great. Thank you so much. We're
Sure.
going to come back with lots more. So, Dr. Mealy, thank you. If you want more information, just call the doctor's office. That number is 925-943-6353, or you can go to drmealy.com or sanfranciscobreast.com. We've got lots more to get to, so keep it right here on Body Beautiful. We'll be right back.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.